So this next topic is about spirituality in aging and aging-related illnesses. And this is a topic that is often not covered in typical practices. And look, this has been an amazing weekend, and we've had great speakers, as I think everybody will agree. But I'm really thinking that this next speaker, Michael Estlin, might change everyone's practice way more than anything else you've heard this weekend. Because I think a lot of us are sitting in the room with the patient, and we know that inside their heads, they're struggling with existential issues. Like, what's the value of their life? How about the losses, their friends and family? How about the loss of their personality, who they are, and their leadership in the family roles? All of this are enormous existential issues that provide depression, anxiety, and definitely make it more difficult for them to live a graceful and productive life. So bringing in the spirituality issue and dealing with existential challenges is something that we all need to learn more about. And I don't think there's anybody more qualified than Michael Estlin. Michael is the chaplain for the Sims-Mans Center at UCLA. And as part of the oncology service, Michael is dealing with these existential issues in an accelerated fashion, in a very difficult to deal with population. Does it with grace and amazing talent. And what more can I say except, Michael, take it away.
Thank you so much for the nice introduction. In the patient population that I serve at UCLA, I would say that the lion's share of patients would identify as some flavor of spiritual but not religious. That would be consistent with how current polling assesses Americans and how they identify themselves spiritually. It's an ambiguous expression. It doesn't mean the same thing to everyone. So I will often ask a patient, what do you mean by that, spiritual? Or they will ask me. For myself, I'd have to go back to the Latin root of the word, spiritus, which only means breath. What is it that breathes life into your life? What is it that gives it meaning? What is it that makes you want to get up and face another day? Now, for some, that might mean a deep connection to a religious tradition or practice or community. For some, it might mean a relationship to a personal higher power. For some, it might mean their family or their work or their dog or a great round of golf or surfing the perfect wave. For some, it might mean a place where they feel this connection to a power greater than themselves, a redwood forest or a seashore, the desert, maybe the Thanksgiving dinner table. Well, as anyone in this conference can attest, a diagnosis of cancer or any critical illness can really mess with all of that. Because what used to seem meaningful yesterday, today seems meaningless, or I don't have access to it in quite the same way. So I either need to find a new meaning or a new pathway to connect to the old one. Permit me this little digression, if you will. 36 years ago, my husband Scott and I took a trip to France, and we spent an entire day driving through Normandy, touring the D-Day beaches, which was territory that my own father had bombed some 40 years earlier from his B-17, paving the way for the D-Day invasions to follow. At the end of the day, we made our way to Mont Saint-Michel off the north coast of Brittany, and we arrived just as the sun was dipping into the sea behind the silhouetted spire of the mount, rising up from this vast coastal plain. I was transfixed by the mystical beauty of this improbable medieval gem and by these swirling tides that looked as if the gods were pouring water over the earth from some unseen pitcher. We bedded down for the night at Mère Poulard, and we made a reservation for an English-speaking tour of the Abbey at the very pinnacle of the mount for the next morning. Well, the tour guide spoke with such a thick French accent that I could maybe only understand every third word of what she was saying. But she did use an expression I understood quite readily, the Gothic heart. Actually, it sounded more like the Gothic heart. The first time she said it, I turned around and poked Scott. Ooh, the Gothic heart. I love that. What do you suppose that's about? I think I have one. I've always felt this affinity for the Middle Ages and for monastic life in particular. Though she went on to use the expression several more times, she never came back around to any explanation that I could understand anyway. Until about 45 minutes into the tour, I realized she wasn't saying Gothic heart at all. She was saying Gothic art. Those of you old enough to remember Gilda Radner on Saturday Night Live, her character, Emily Latella, I had my own little Emily moment. Never mind. Still, I was crestfallen. I loved the idea of the Gothic heart, so much so that it still sticks with me some 36 years later, but all in my imagination. My point being, meaning making is a creative endeavor. It is personal, it is individual, it is ever evolving. We do, in part, make meaning communally as a society. And sometimes those communal meanings can seem fixed, solid, maybe even universal. A shiny new BMW means financial wealth. Financial wealth means success at life. A long marriage means you must be happy. As the wave of life washes over us, we come to understand how untrue such assumptions can be. But still, it is our creative choice whether we would choose to align with the communal meaning or something else altogether. The world of cancer, any critical illness, has a whole universe of communal meaning attached to it, most of it couched in the terms of war and struggle and battle. The language is so pervasive, so ubiquitous, we may not even be attuned to it any longer. Oh, she's battling breast cancer. We'll read an obituary. He lost his fight with lung cancer. Does it really need to be seen through that lens? Many of the patients I walk beside reject such imagery of war and battle. They choose to reject such imagery. Clara, a young girl, 22 years old, undergoing a stem cell transplant for leukemia, her mother by her side every step of the way. Clara and her mother are devout Christians. Now, I'm used to hearing about the perspectives through which many Christians will view their crises, but Clara and her mother had a unique perspective as far as I was concerned. Her mother said, Michael, this cancer is a part of my daughter. Therefore, it's a part of God, and I have to love it. As I love my daughter, as I love God, and I believe through that love, she will be healed. Claudia, breast cancer patient, agnostic, told me, Michael, I can't afford to be at war with my own body. What if my body's doing the best it can? I want to love my body. I want to love it so well that that cancer just releases and goes back to wherever it came from. In a similar vein, Rhonda shared with me her view that she saw her cancer as a dance with a tiger. And Michael, I'm just waltzing that tiger back into its cage. Still, others do resonate with that language of war and battle. Sergio, 22, testicular cancer, used to envision his chemo infusions as a kind of violent video game, a war to be won. The thing about seeing cancer or any such crisis through the lens of war and battle is that it promotes a black and white, dualistic, either or kind of thinking with language like win, lose, victory, defeat, success, failure. After all, what does success with cancer look like? Well, the obvious answer is cure, right? Or at least complete remission. But if I've supposedly been cured of cancer, but I am living in mortal fear of a recurrence, or I'm grieving so terribly what I lost along the way, who won the war? We had a discussion about this very topic in the Circle of Reflection, a spiritual reflection group I facilitate each week at the Sims Mann Center at UCLA. What does success with cancer look like? There was not consensus within the group. For some, success meant getting my old life back, whatever that meant to them. For some, it meant living long enough to see a beloved child or grandchild graduate or get married or be born. For some, it meant finishing the book I've been writing or living into a deeper kind of spiritual peace and acceptance. For some, it meant living long enough to be an inspiration to others. The thing about success and failure, sometimes it can be hard to tell which is which. What if it isn't a matter of success and fail at all? What if it just is? Cancer is like a wave in the ocean moving toward the shore, unstoppable, impersonal, a wave that has the power to cause harm, to be sure. But surfers pray for such waves, for the sublime thrills of the peaks and valleys of the ride, even the thrill of the risk of wiping out altogether. From what I've observed of those riding the cancer wave, the opportunity also exists, maybe even the invitation for profound spiritual growth. We might come to a whole new understanding of who we are, what we're made of, what we're connected to. We might come to understand new definitions for words like heal and success. We might come to understand in a much deeper way what it means to be a human being, what it means to love and be loved. Or we might not. But the wave is real, and it will take us on a ride, whether we would go along willingly or not. And before you say, oh, Michael, come on, nobody goes on this ride willingly. I did have a patient once, Dinesh from India, steeped in Hindu culture and religion, who, when diagnosed with gastric cancer, greeted that news with this kind of equanimity. Okay, Michael, now I get to experience what this is like. And now, while the wave is real, it is also an ever-shifting, ever-changing environment. And our capacity to ride that wave needs to be adaptable to those ever-shifting circumstances. Like taking any trip at all, it is a skilled traveler who can let go of yesterday's reality, yesterday's expectations and goals, and adapt to today's reality, expectations, and goals. Maybe this trip started off to be our ideal honeymoon to the Bahamas. But now with this hurricane in the forecast, it's about getting home safe and sound. And how we choose to meet that wave, I would say, is ultimately a matter of faith. Now, it might be a faith that is expressed in religious or spiritual terms, or a faith that might be expressed in secular terms, but it is faith nevertheless. In religious terms, that faith might be that God will heal me. In secular terms, that faith might be in one's doctor, or this latest drug trial, or vitamin D. One article of faith that seems to transcend the religious secular spectrum is the idea that things happen for a reason. Maybe everything happens for a reason. Now, that reason might best be articulated in religious language or spiritual language or secular language, but the concept is the same. In religious language, that reason might be the Lord is testing me or God is punishing me. In spiritual language, that reason might be, Michael, this was a wake-up call. It was a reminder not to sweat the small stuff, to pay attention to what really matters. In completely secular language, that reason might be, I was living an unhealthy lifestyle. I really got to get myself into shape. I've got to eat better. I've got to exercise. For some, the faith is so fundamental, it just doesn't need articulation. I just believe everything happens for a reason. We can't know what it is. Now, any one of those statements of faith has the power to soothe and to calm, but it also has the power to intensify our suffering. When we go to the place of, it's because of something I did or didn't do that I have this cancer, something I believed or didn't believe, something I prayed or didn't pray, I must be some kind of idiot to have needed this life lesson. Couldn't I got the cliff notes on this one? Where that article of faith meets the wave does seem to tell the tale. And it can often mean a spiritual crisis. When we go through life, often so certain of what we believe and hold to be true, we meet a crisis like cancer, suddenly all bets are off. So I suppose a good place to start is, what's my relationship to spiritual crisis? Can it be okay for that first wave or 2 or 10 to wash over me, hold me underwater, leaving me gasping with a mouthful of sand and water, spitting and sputtering, flaying about, trying to get my bearings in this new reality, trying to understand where it is now I want to put my faith? I meet plenty of folks who, when I'm introduced as the chaplain, will comment, oh, I have a very strong faith. I'm just fine. Thank you very much. And I know they think they're being perfectly clear in saying that, but I don't know what the hell they mean. Faith in what? in God, in Jesus, in their higher power, in themselves, in their own capacity to survive. And if it is a faith in God, what does that faith tell them? That they'll be healed, or that they're not alone, or that they have what it takes to make this journey, that it's thy will be done, not my will be done. Every one of those statements of faith is going to ride the wave in a different way. And what happens when that faith just isn't up to the rigors of this particular wave? Ruth, I only met once on her first day of chemotherapy, newly diagnosed with breast cancer. Ruth was a devout evangelical Christian. Michael, she said, the Lord isn't testing me with this cancer. I'm testing the Lord because I'm going to go through chemotherapy and I'm not going to lose my hair. Too many people are counting on me. I can't afford to have anybody know that I'm sick. Well, this raised a particular red flag for me. What will happen when she does lose her hair? What kind of spiritual crisis might that be? Now, as I say, I only met her once, so I don't know what happened when she lost her hair. But if it had been a spiritual crisis, it would be no different than anyone else putting all of their faith in the latest drug trial or vitamin D or my brilliant oncologist, only to discover that their cancer had not been arrested, but had in fact spread. Karen was diagnosed with kidney cancer. Michael, she said, I don't know what I did to deserve this kidney cancer. Karen, what could you possibly done to deserve kidney cancer? What, did you go mow down 17 children in a McDonald's with an AK-47? What? I don't know, she said, but it must be something. And it was as if that statement brought her a kind of comfort in a backward sort of way, because it still promoted the idea, the illusion that she was in control. She had some power here. She was responsible. She screwed up somehow. That's why she had cancer. But hey, she was still in charge. To consider the possibility that the cancer just happened, that she was powerless over it, was unthinkable. She was unwilling to have that conversation. Now, I certainly don't mean to suggest that we are powerless over how we ride the wave, quite the opposite. But what happens when we discover we're powerless over the wave itself? Coming face to face with that powerlessness, I would say, is the core spiritual crisis that affects everyone on the cancer journey at some point or another. What happens when we discover that we are powerless over the wave? You can ask anybody who's been diagnosed with lung cancer or has a loved one been diagnosed with lung cancer. What's the first question anybody asks? Oh, was she a smoker? Were you a smoker? I would suggest it's our fear of powerlessness that would drive such an insensitive question. Oh, she was a smoker? Too bad. I don't smoke, therefore I'm safe. What happens when we can't control the wave? At that particular junction where our faith meets its limitation, where our certainty meets doubt, many people get angry. They get angry at God, at their doctors, at themselves. They get angry at themselves for what? For not going to the doctor sooner, for not taking better care of myself. One woman just broke my heart when she said, Michael, I don't think I've lived a good enough life to get God's attention. I don't think I deserve a miracle. Carolyn had no trouble at all articulating her particular spiritual crisis. If anything, she was just so grateful to have someone listen, to be a witness. When we met, she told me that 5 years earlier, her 35-year-old daughter had been killed in a car accident, leaving behind her 2 pre-teenage kids to now be raised by her substance-abusing former son-in-law. And now she finds out that her own 39-year-old son has been diagnosed with a colon cancer with metastasis to the liver. It was too much. Michael, I understand about loss. My mother died when I was 9, my brother when I was 15. I've worked in healthcare. I know about loss, but I can't take this. It's too much. She was one that had been deeply rooted in her Protestant faith tradition and had always derived a lot of comfort from her prayer life, but now says, Michael, I can't pray at all, and I don't even want to. And when friends tell me they'll pray for me, a part of me wants to say, don't even bother. Isn't that terrible? We looked at her faith and what it really said, what her statements really said about her beliefs about God and the nature of prayer, but through the relationship, through the lens of relationship. Did this standoff with God, this idea that I'm so angry right now, I can't even talk to you. I got to go take a walk around the block. Does that mean she's no longer in relationship to God? I would say quite the opposite. In fact, I might assert that that walk around the block might even be its own kind of prayer. We only fight with those we care about, after all. Otherwise, we would be indifferent. I just want you to understand. Would you just get it? We so desperately want to be understood and to understand the other. Can it be okay for that wave to hold us underwater for a time? What I have found is that in time, we do float. Rita was so desperate for someone to blame for her cancer. I just want to know why this happened. I need somebody to blame. I wish I could blame my husband. That's what I really wish. And I'm so angry, Michael. I'm angry at the doctor who missed this diagnosis 2 years ago. I'm angry at myself for not going to get a second opinion. I'm angry at myself for being angry. I just want to know why. Almost universally, some point along the way, a patient will share with me this desire. I just want to know why this happened. And I will often respond, if I could give you a sealed envelope right now with your name on it, and inside is a card, here's the reason you have this cancer. Would you open the envelope? And if you did, do you suppose you would suffer less or suffer more? To find out, it's because you ate too many Big Macs in high school, spent too much time in the sun, drank a little too much, maybe you smoked. Maybe it's karma, maybe some sin you committed in this life or past life. It's just your genetic bad luck. You shouldn't have lived in a polluted city. You shouldn't have done that job for a living where you're exposed to all that asbestos. What to do with that irredeemable regret and guilt? What if it's nobody's fault? What if it just is? What if the wave is impersonal? Coming to a new relationship with that powerlessness can open whole new windows of new dimensions of peace of mind and heart. Yes, that powerlessness is most definitely the source of our greatest spiritual distress at first, but it can open this doorway to a whole other kind of peace, healing, maybe even enlightenment. Another word for that powerlessness might be vulnerability. There is so much in our culture that would encourage us to avoid vulnerability at all costs. Wear your seatbelt, lock your door, buy more insurance, get an alarm, get some kind of camera for your house. Don't drive in that part of town at night. Don't talk to strangers. Don't show anyone your weakness, and don't let anybody see you cry or that you hurt. From what I have found, just the opposite is true, that the magic in life gets revealed when we move toward our vulnerability, not away from it. And if cancer is anything at all, it is a doorway into the land of the vulnerable on so many levels and in so many dimensions. Still, it is our creative choice how we will meet that vulnerability. We might meet it with antagonism, denial, regret, anger, kicking and screaming every step of the way. No, no, no. Or we might meet it with more curiosity than fear. Either way, we are guaranteed profound growth. This particular relationship holds up a mighty powerful mirror to everything we have held to be true and dear and sacred about ourselves, about life. One of the oncologists asked me to come see Victor, who had just found out that the pain in his back, which he was certain was a pulled muscle, was in fact a metastatic sarcoma. It was nearly impossible for Victor to take in this information because it didn't comport with the truth of how he saw himself. He saw himself as pristinely healthy, as a vegan, as a massage therapist, as a meditator, as a deeply spiritual person. It took a good hour to tease apart the truth of what he had really heard from the doctor and what his options were and what they weren't. And he started from a place of, well, there's no way I'm taking chemo. That's toxic. It's poison. I wouldn't put that in my body. It'll kill you. Maybe it's just time for me to die, though he was a quite young man. In time, he moved from that position to a willingness to undergo chemotherapy. And rather than call it toxic or poison, he calls chemo his golden infusion. It's been several years now. His disease is stable. He's doing quite well. But it has been an incremental journey moving from this place of resistance to a place of what I would call self-empowerment, of being at choice, a willingness to be creative in how I'm going to perceive my circumstances. And like any learning process, it is incremental, and there are obstacles and there are opportunities along the way. Both on this particular journey are formidable. From what I observe, the obstacles in coming to peace with powerlessness have everything to do with a theme of attachment. Attachment to belief systems, attachment to outcomes, attachment to my own expectations, even attachment to my own identity, as I understood it. I've worked in many different settings as a chaplain over the years. I worked in the psychiatric hospital. I've worked in hospice. I've worked in palliative care. I worked in liver transplants for a time and for many, many years with cancer. And in each setting, I find there's often a unique constellation of spiritual themes that come up for review. In liver transplants, for instance, so many people need new livers because of past self-destructive behaviors, drug and alcohol abuse, for instance. So there can be a lot of shame and disgrace. Do I really deserve this second chance at life? Do I really need to pray that somebody dies so I can get their liver? With cancer patients, I find often one's whole identity deconstructs as piece by piece of one's identity just falls away. Robert had been a brilliant engineering professor, highly regarded. He now has a brain tumor. Michael, I used to be smart. That's who I was. But I'm not smart anymore. I can't find the easiest word to finish a simple sentence. Does Robert cease to exist in that moment? Is he no longer there? Is he a different version of himself? I invite you to think right now of 4 or 5 things that make you who you are. That if anybody's going to know you at all, they're going to know these 4 or 5 things about you: that you're a brilliant researcher, a scientist, or physician, that you're a talented artist, a gifted athlete, that you're perhaps known for your great physique and your beautiful head of hair. That'd be me. Imagine none of that is true anymore, or not in the same way. Who would you even be then? Is there an essential you who dwells beneath all those labels with which we would identify, under all those hats we might wear? What's more, is he or she worthy of love? Is he or she capable of giving love? As painful as it may be to entertain those questions, they do reflect a most profound spiritual journey through loss, toward essence, if you will, even that which may be indestructible within us. Having walked beside countless patients whom I would just as soon call my teachers, as they walk through these questions, what's on the other side of them is profound indeed, and it is often beyond words. And yes, nobody bought a ticket for this particular journey. And yes, this may indeed be a blessing to move toward this kind of spiritual awakening toward my essence. But one thing that can hinder it is an attachment to an old, limited, or outmoded identity. One of the oncologists asked me to go see Vicky, who was quite distressed, so distressed, in fact, that the doctor thought she might need a psychiatric evaluation. In any event, Michael, she's up on the floor now and she's sobbing. Will you go see her? Vicky's been living with this rare lymphoma for maybe 15 years. And in those 15 years, she's been on maybe a dozen different drug protocols. Each one has worked for a time and then lost its effectiveness. Today was day 1 of yet another drug protocol, and Vicky was just cooked. But to hear her tell it, Michael, really, I'm so lucky. I'm the most blessed person in the world. I've got the most wonderful husband, and I've got wonderful kids and grandkids. And everybody says I'm so hopeful and optimistic, and I have a wonderful church community. I have wonderful doctors. Really, I'm so lucky. And it was like the longer she talked, the higher her voice got, the shorter her breath, as if the rope were getting tighter around her neck, because she just couldn't reconcile these all too human emotions of weariness and disappointment and regret and fear with her attachment to this very limited image of herself as Little Miss Sunshine. She went on to say, and Michael, look at all these people in the clinic. So many others have it so much worse. Why am I such a baby? So now she's heaped on that level of self-judgment. It's a common coping strategy, this it could be worse strategy. We all use it from time to time as a way to somehow snap us awake into an attitude of gratitude, if you will. But I find more often than not, we use it as a weapon to beat ourselves up, particularly with cancer patients. I wasn't hopeful enough. I wasn't positive enough. I wasn't prayerful enough. I was too busy judging the suffering sweepstakes and figuring out where it is I fit in the lineup. It was as if she were trying to compose a symphony called Vicky, but had decided only these 4 or 5 notes would be acceptable. Only these notes of gratitude and positivity and hope and love and forgiveness could be used. There was no room for any deep, dark notes of resentment and fear and blame and vengefulness. It takes all 88 keys on a piano to write a full-bodied symphony. All the sweet high notes, all the deep, dark, low notes, and everything in between. A few dark notes in the symphony of Vicky does not make her less of who she is. It makes her more. I don't think she was in any danger of becoming this black hole of despair. She was moving toward grace and allowance to be all of who she is. She's doing quite well now, quite stable. She remains her essential sunshiny self, but with a little more grace and allowance to be a 3-dimensional human being with a full range of human expression. Yes, those waves of suffering can wash over us, carry us out to sea as if we're caught in a riptide or by an undertow. I grew up in Long Beach, California, and every spring in school, I remember the lifeguards would come give us a water safety assembly. And they would tell us what to do if we got caught in an undertow or a riptide. Don't swim against it. You will lose. You might drown. Let it carry you out. And when you can, swim out of it, parallel to the shore. Get your bearings, rest up, and then swim back. Struggle, I find, only guarantees more struggle, more suffering. It's like when we were kids, there used to be these bamboo Chinese finger puzzles. You got at carnivals, little bamboo tubes. You'd stick your fingers in and, Mom, I can't get my fingers out. And then when you breathe and relax, they just slide out. We might be overwhelmed with these feelings. This isn't supposed to be happening. God has a bigger plan for me. I need to be more positive. I need to be more prayerful. To doubt is to sin. Maybe it's best to just let these feelings carry us out for a time. And when we can, swim back to shore. Sometimes it might not just be our attachment to an old limited identity that trips us up. We can unwittingly become attached to our new identity as cancer patient. I can't tell you how many times I will meet a patient, and when I ask them about their life before cancer, outside of cancer, and I hear about their family, their grandchild, their dog, the whole shape of their face changes. Oh, you won't believe the cute thing my dog did this morning. Let me show you a picture. It's as if they had forgotten for that moment that they are more than this person who sits in a recliner all day hooked up to an IV drip, that they're connected to more, that they're more than this person who wrestles with an insurance company all day. Kyle presented a most interesting twist on this attachment to identity as cancer patient. Kyle's one of the lucky ones, cured of Hodgkin's lymphoma, given the all clear by his doctor, go live your life, be well. And for a time, he did just that. He did great. And people were asking him, his church community, to give an inspirational talk. But suddenly he found himself immobilized, paralyzed with fear and grief. It had all sunk in. He was grieving so terribly what he lost along the way, fear of what's coming. Could there be a recurrence? Michael, I don't get it. I'm one of the lucky ones. I'm the one who made it. People ask me for inspiration. It was as if he had become attached to this new identity of cancer patient as superhero, kind of the latter-day Lance Armstrong, if you will, before his fall from grace. We looked at what it would mean to come out from behind that mask, to come out with some humility, to give up that, what some of my patients call the tyranny of positive thinking, and to admit, you know what, I beat cancer and it still kicked my ass. It still kicked me to the curb. What kind of an inspirational lecture might that be? Offering folks grace and allowance to be a full dimensional human being without all the answers. Sometimes it's not just attachment to an identity that trips us up in our pathway to peace with powerlessness, we might become attached to an idea or belief system itself. One belief that I think many of us carry, though we might be reluctant to admit it, is that life, the universe, the earth is a just and fair place. Oh, the pain of giving that one up, or at least giving up the possibility that maybe it's fair, but I just can't see how true it is. Heidi, 32 years old, was diagnosed with ovarian cancer. She called our center desperate for someone to talk to help her make sense of all this. She used that expression several times. She was deeply rooted in her Protestant faith tradition, but recently had found some comfort in some Buddhist reading she had done. Michael, I don't understand how this is happening to me. I'm a good person. I've never knowingly hurt anybody. I'm always the first one to show up to volunteer. I was just taught to be that way. I've been praying so hard to God and he won't answer. I'm so angry. Why is this happening? She raises so many themes there beyond this desire to make sense of it. Who or what is God? How does prayer work? What do I do with this anger? But front and center is this theme that it's just not fair. It's not just. Over my years of study, I've come upon this hypothesis that for any genuine transformation to take place, it must be preceded by a betrayal and a death. Betrayal, death, transformation. We might look to the Jesus story as an example. Jesus had to be betrayed, had to die for the whole centerpiece of Christian thought to take place: resurrection, transformation. This pattern exists in many of the world's great myths, particularly in Greek mythology. Now, it needn't necessarily mean a physical death, but maybe the death of a belief, the death of a relationship, maybe the death of a career path. Might be interesting to look back at your own life at moments of profound growth and see if such a moment was in fact preceded by something that could be seen as a betrayal and a death. With Heidi, as it is with so many patients, that faith wasn't big enough for this particular reality. We teased apart what her statements really revealed about her actual beliefs, and she had to acknowledge that she believed, if I'm a good person and I do the right thing, I won't get sick and I'll never die. It's not so different, really, than a belief in Santa Claus. If I'm a good little girl, eat my vegetables, don't sass back, I'll get a shiny red bicycle for Christmas. That belief had to be betrayed and had to die for there to be any possibility for a new faith, a new understanding that could include this new reality and circumstance. In a way, she had to grieve the death of Santa at 32. Something for all of us to consider. Can I be open enough and porous enough to allow in a new truth when the old one just isn't big enough for this particular reality? Angela came to the same spiritual crossroads, but from a very different path. She came from a path of meditation, a belief in Eastern philosophy, a belief in karma, another way of saying it's a just and fair universe out there. Michael, when I was first diagnosed, I started meditating regularly. I was so disciplined about it, 4, 5, 6 times a day. And then my scans revealed that the cancer had not been arrested, but had in fact progressed. I felt so betrayed. And I realized I hadn't been meditating for the right reason at all. Not for the peace it could give me in that moment. I was meditating because I thought it might cure me. Both Heidi and Angela were attached to very specific outcomes, namely cure. It was the only thing that would do. Now, it would have to be the most human of all urges. Who doesn't want to be cured of cancer? But what if it's just not in the cards? What if the most either could hope for is simply more time living with chronic illness? Or what if, God forbid, this disease does mean the imminent end of my physical body? Am I no longer entitled to peace of mind and heart? Am I no longer entitled to an experience of healing that may not include cure? Is that even possible? Ben was this lovely older man in his 70s, end-stage liver cancer, not much time left, and he knew it. And to top it off, his wife had stage 4 breast cancer. I knocked on his door, went in to offer a visit. He gestures to the chair. Come in, sit down, as if it's cocktail time. So tell me, Ben, what's going on? Michael, it's the best time of my life. I guess that makes me sound crazy, huh? Not at all. I said, tell me more. It's like for the first time in my life, I feel comfortable in my own skin. I get it. I understand my role in life, and it's enough. I'd like to see Yellowstone one more time, but you know what? It's enough. Personally, I don't know that there's much more to aspire to in life than that sense of enoughness. This life, this relationship, this job, this day, this afternoon, this moment, this breath is enough. It's not at all uncommon for me to hear cancer patients say that they see their cancer as a kind of blessing. Sometimes that comes off as heresy to them. Sometimes it's shocking. Sometimes it's liberating. Jill, very likable, but tough gal. Tough. Steeped in a family history of values that is so rooted in resilience and toughness and don't let them see you cry. It was everything. She was so firmly attached to that value system that when she was diagnosed with multiple myeloma, she was considering not getting treatment. I just can't have people feeling sorry for me and wanting to help. Maybe it's just time to go. She's changed her tune in time. And now, having chosen to undergo treatment, she shares with me these little miracles that happen in her life when she dares to tell people about what she's going through. Particularly with my boss, Michael, we really had a hard relationship. I didn't know if I was going to be able to stay there, but when I told him about my cancer, he told me about his wife's cancer. We've kind of become really good friends. I'd almost have to say, I'm glad I got cancer. And then she shocked herself. I can't believe I said that. I've never said that. I've never even thought it. And then she said it again. Yeah, I guess I'd have to say I'm glad I caught cancer. Talk about betrayal, death, transformation. Jill, like so many patients, like all of us really, are so proud of our resilience and self-reliance and independence. And these patients will share with me the challenge it is to need the help that cancer demands. Needing it is one thing, accepting it is something quite another story. Vulnerability again. And yet, I hear almost universally from patients this experience of being overwhelmed by this outpouring of love, often from the unlikeliest of sources when they dare to be vulnerable. It's often not the best friend who you were so certain would be there for you no matter what. It's a woman down the street whom I barely know, who shows up with a casserole and she offers to take my kids to school for me. It's a kind of love that is healing, powerful, restores one to our interdependence, to community. The irony is it takes a lot of strength to be vulnerable. Louise is this powerhouse gal, a museum director, the kind of go-to person if you want to get something done. And she told me what happened when she had to come out at work as someone dealing with lung cancer, that I have to pull back. The craziest thing happened, Michael. People started coming to me with their problems. These are problems, I got to tell you, that pale in comparison to cancer. But the thing is, it was such a gift to me because I was given this opportunity to be of service and to connect with people with whom I'd never been able to connect before. I'd call that a kind of magic. Sometimes on our journey toward coming to peace with powerlessness, we're not just tripped up by an attachment to an identity or to a belief, but we can become attached to meaning itself. We hold it too tight. We don't allow it to blossom, to unfold. We don't allow it to change or to change us. Or sometimes we might even confuse our experience, or maybe even an object, with the meaning itself. Lourdes, razor thin, in her 70s, wheelchair bound, tenderly cared for by her son, Enrique. She's got rectal cancer. But on this particular day in the infusion clinic, she was very distressed and tearful. She was telling me the story of how decades earlier, when she left her native Puerto Rico, her mother had given her a few precious pieces of jewelry to remember her by. Now, Lourdes is also a bit of a pack rat. She keeps all of her belongings in little bags and baggies strewn on the floor surrounding the recliner where she spends all of her waking hours. Earlier that week, in an attempt to tidy up, Enrique inadvertently threw out the baggie with the jewelry in it. Lourdes was beside herself with grief and anger. I haven't been able to sleep all week. I haven't been able to eat. The nurse just told me I lost 5 pounds. Now, if you'd seen her, you'd see she didn't have 5 pounds to lose. And I'm so angry with Enrique. Why is he so careless? Why is he such a control freak? I invited Lourdes to gently dip into the spiritual waters of forgiveness, which was not a good call on my part, I must admit. So then I invited a reflection on what was the real gift her mother gave her. Was it really a few pieces of jewelry, or was it her undying love and affection? That's a gift that can't be lost or misplaced or thrown away. In a similar kind of way, it seems she had the gift of precious little time left on the planet. Would she spend the gift of that time enjoying the love of her son, Enrique, or would she spend it stewing in her own anger and grief? She just might. That would be her right and her choice. I sometimes think the very last power we have is the power to assign meaning to our stories. Who has the standing to assign the meaning to our own stories, to our own journeys? Almost universally from patients, I hear of how many people in their world have just the idea of how to fix them up. You got to go to this clinic in Germany. I read about this place in Mexico. You got to come to my acupuncturist. You got to read this book. You got to say this prayer. Come to my church. Eat more kale. I imagine all of us have those people in our lives who are all too happy to tell us exactly what sense we should make of our lives, what it all means, and how we should feel about it. And there's a part of us that might even long for their affirmation and validation. And in doing so, we kind of give up the dignity and the honoring of our own hard-won journey, our own hard-won riding of the wave thus far. Every cancer patient has had to struggle with which institution am I going to trust? Which doctor am I going to trust? Which regimen am I going to trust? And they need those people in their world to acknowledge that and be beside them, as we all do. What would it mean? What would it look like for all of us to really honor our journeys, the mistakes we've made, the choices we've made, to walk beside one another without wagging that fear of, you should try this? What would it look like through these endless cycles of betrayal and death and transformation? My father died on New Year's Eve, 2004. There aren't too many relationships that would seem to have more intrinsic meaning than that between a father and a son, a mother and daughter. It's ancient, primal, organic. We don't have to look too far to see how untrue that is for so many. We had an uneasy relationship at best. And though he's been dead for nearly 17 years, I find the meaning of that relationship continues to grow, change, evolve. 7 years before he died, my sister Terry and I interviewed Albert on videotape rather exhaustively about his life. Still, it's just a snapshot. It's not the whole picture. I mentioned earlier that he flew B-17s over Germany during World War II. He was telling us a story about a ritual he had with his crew before they would take off on a mission to check out the intercom system. My dad would begin by singing into his headset, I've flown around the world in a plane. Bombardier comes on, I've settled revolutions in Spain. Tail gunner comes on, the North Pole I have charted, but I can't get started with you. It was a popular song of the day. I thought that story was so small and sweet and specific, and it brought the most youthful human dimension to a man, to an experience simply beyond my comprehension. Many years after the war, my dad called his co-pilot, Milton Tarr, out of the clear blue. Milton answered the phone, and my dad just sang, I've flown around the world in a plane. Milton just barked, who the hell is this? It's me, Milton, Albert. Remember how we used to sing that before we took off on a mission? Milton had no recollection, which made my dad sigh, of course. Us too. And I've spent some time wondering why that story still touches me so deeply. I don't know. I don't think my dad was ever at ease in his role as a father, certainly not one with two gay children. And the times when we could ever meet, be on the same page about anything, even though it was far more likely we would meet on his page than he on ours. Well, those times were special and precious, and they have meaning for me. And what I take from Dad's story with Milton and from all of these stories, really, is that our lives, our riding of the wave, and the meaning we take from it is our own. To make of it what we will. Can we hold it, caress it, let it comfort us, let it trouble us, let it change meaning or even lose meaning altogether? And if somebody else gets it and can share it with us, even for a moment, that's gravy. But we always have the meaning to ourselves. And it's enough for me. And I still love the idea of the Gothic heart, even if there's no such thing. May we all ride our own waves with grace and allowance, keeping our eyes and hearts open for blessings we don't even know we're looking for. It is ours. Thank you.
Thank you so much. That was really wonderful, very touching. Yeah, really brought a tear to my eye. And I'm sure we're all reflecting on things that are important to us. We have a couple questions, and one that might even, Michael, push you in a new direction. Maybe you've encountered this. It's a question from David. I don't know if you are able to read it. It's a bit of a lengthy one. You just click the Q&A at the bottom of the screen.
Okay. And it's hard for me to read from this. Do you have any thoughts, comments, do you have any thoughts or comments on the end of life people using guided plant-based psychedelic experience to connect their spirituality, connectedness to universe and others, or on those microdosing with psychedelics, mushrooms? I am so excited by this possibility. I don't have direct experience. I have patients who desperately are trying to get access to these, but some of them are available only through studies that are closed. I have one patient who deals with clinical depression and has her whole life, and now with cancer, it's too much, and she doesn't have the resources to do this on her own. I will say anecdotally that even before this became an option and it was being studied more seriously, some patients that when I got close to them and they would reluctantly share this, the peak spiritual experience of their lives was maybe an acid trip they took in the 60s, and they would tell me about it. I'd like to try it myself. I just haven't had the access or the opportunity, but I think it could offer a lot of opening for many people. I think there are studies with a lot of cancer patients that show almost unequivocally that the fear of dying gets diminished dramatically once they've had these experiences. And next question, do you take patient referrals from anywhere in the world? I see only cancer patients at UCLA. I mean, that's my official job. I have seen people privately, individually, and you can contact me through my website to try to set that up, which is www.michaelesselin.com. Maybe we can put that in the chat, and you can contact me through there and see if I can be of help. But thanks for asking.
Michael, I had a question for you.
Yes, sir.
I think this spiritual realm and making meaning of life and figuring out your role in life and all these existential issues that come up when people are losing their personality and losing who they are because of an aging-related condition. So how do you think the best way of starting the conversation would be with the patient and the family? Often there's a caretaker. Very often it's the daughter. But what would be the best way to figure out what their spiritual resources are, how to figure out if they're ready to accept help, and how to get that help to them? So how do you start that whole process? What would you advise the participants in this Brain Summit? what would be a good way to start that whole thing?
Some of it is going to be dependent upon the demographics of the patient populations you serve. If you're working in an area where people are highly religious by nature, then you're going to start a little differently than in West Los Angeles, where more people are saying, I'm spiritual but not religious, or no, that is not of interest to me. But these questions of meaning making are still relevant to everybody. I think the minute you ask somebody that you just see them as somebody other than who's a caregiver, be sure you give them this pill 3 times a day. This has got to be so hard on you. And you can even suggest their reality. I see that your mom is slipping away. That's a kind of grief, that's a kind of death, and it's painful. It can be by inches. To let you know that you see them. I, as you know, give a lot of talks, and I gave one once to a cancer support community here in Southern California to an audience of only cancer patients. During the Q&A, this woman asks me, what's the meaning of life? Oh, that. Let me see, just a moment. And I'm scrambling to think of an answer. And she doesn't wait for my answer. She says, well, I think the meaning of life is that everybody wants to be known, not as in famous, but as in seen. At the time, my judging mind went into overdrive, and I thought, well, that's way too simplistic, dear, but thank you for the question. Is there another question out there? But I've quoted her 10,000 times in the years since. I think she came close to hitting it on the money. We all want to be witnessed and seen in all of our dimensions. I see that your job is hard. I see that this is hard for you. I see that this is a big day for you. It happened once a couple of years ago. One of my Achilles heels is making a mistake that costs money to remedy. If I get a parking ticket, I feel like I don't deserve to live. How could I be so stupid? And it's just my weakness. So I'm at the gas station, it's full, I'm backing up, I'm looking at my rear view camera, I've got this old Prius, and I'm being really careful, and I hear crunch. And I'd hit one of those 3-foot tall concrete posts that caused $1,500 of damage on my car going 2 miles an hour. I thought I had to die at that moment. There's this big guy who's pumping gas in front of me. You'd never characterize him as the merciful angel in this moment. He comes over to me and he says, oh man, dude, that's rough. I'm sorry. My heart was lighter. It didn't fix anything, but somebody saw it and got it, how much it hurt. And that's something that all physicians can do that sometimes they resist doing. It's like just the facts, do this, do this, do this, and we'll see you next week. I see that this is really hard. Tell me what you're going through. What's it like for you right now? You might be surprised. They might say, they might be resentful as hell. I never loved my mom that much, and now I'm stuck doing this. They might feel trapped. One thing you learn as a chaplain, don't make any assumptions about, ask open-ended questions. There's a part of me, I remember going to see a patient very early on in my internship, and the adult daughter's there tending to the mom. And I want to say, oh, you must love her very much. And I just zip it up, because then she says, I'm really pissed off. I don't like my mother and I'm trapped here. Once in the liver unit in the ICU, I went to see a patient who had had his second liver transplant and was failing. And there was a woman whom I didn't recognize at the bedside crying. I asked the nurse, who's that? They said, it's his wife. I went up to her. Your Hallmark version wants to say, oh, you must love him very much. And so I just said, well, tell me, what was your relationship with him like? And she said, he used to beat me, and I haven't seen him in 25 years. Well, those tears are very different than I love him so much, please don't die. How can we be willing to see and be curious enough to know what's this like for you, and be willing to hear the answer? That, I would say, is the best thing you can do. That goes beyond religion, but it's right to the heart of spirituality.
Thank you so much, Michael.